Ever wondered why stress can cause ulcers? Let's dive in. Stress-induced ulceration is a medical term referring to ulceration or erosion that occurs in the upper gastrointestinal tract of ill patients, typically those in intensive care units. These lesions are most commonly found in the fundus of the stomach. Stress, it seems, can literally eat away at us from the inside out. Understanding the definition is the first step towards understanding stress-induced ulceration. Now that we know what it is, let's explore why it happens. The exact pathophysiology of stress-induced ulceration is not entirely clear, but it's likely that ischemia plays a significant role. Other possible causes may include central nervous system disease, acid hypersecretion, and a condition known as Cushing's ulcers. Physiological stress, think fever, severe illness, or a complex post-op course, has been shown to cause ulcers and erosions. This is where our risk factors come in. Mechanical ventilation, anti-coagulation, multi-organ failure, and septicemia, for instance, can all increase the likelihood of developing these ulcers. Severe surgery or trauma can also contribute, as can a central nervous system injury, which can result in what we call Cushing's ulcers. Lastly, burns involving more than 35% of the body surface significantly raise the risk. Awareness of these risk factors can help prevent the development of stress-induced ulcers. What does a stress-induced ulcer look like and how do we treat it? Let's into the clinical features of this condition. Primarily, these ulcers present with upper gastrointestinal bleeding, often abbreviated as UGIB. By definition, UGIB is upper gastrointestinal bleeding, which is blood loss from a gastrointestinal source above the ligament of Treitz. This may not be immediately apparent as stress-induced ulcers are typically painless. That's right. Despite the damage they cause, these ulcers usually don't cause any discomfort, making them somewhat of a silent attacker in the body. Now let's turn our attention to the treatment. Prevention is the first line of defense against stress-induced ulcers. This is typically done through prophylaxis with gastric acid suppressants. You may be familiar with H2 blockers or proton pump inhibitors, commonly known as PPIs. These medications decrease risk of UGIB, a significant step in managing these ulcers. However, it's important to note that this preventative measure may increase the risk of pneumonia. It's a delicate balance that healthcare professionals must when developing a treatment plan. If an ulcer does develop, the treatment is similar to that of a bleeding peptic ulcer. This approach, however, is often less successful. This is why prevention is so crucial in the case of stress-induced ulcers, to avoid reaching this stage if at all possible. While prevention is key, effective treatment can manage stress-induced ulcers. It's a complex condition, but with careful management and prevention strategies, it's something that we can tackle effectively. Stress-induced ulceration is a serious condition, but with knowledge and awareness, we can manage it. We've covered its definition, pathophysiology, risk factors, clinical features, and treatment. Subscribe to our channel MedSign Health 360 for more informative videos like this. Share your thoughts in the comments below, and join our community of health enthusiasts today.